I think it's going to be a really exciting program. As always, these annual meetings always have lots of exciting results. This year in particular, we have, I think, a major emphasis on immune therapy. There's a lot of excitement going on with new discoveries and how we can boost the immune system to attack tumors. And we'll see a lot of talks showing progress in that area, as well as evidence that it's beginning to work in the clinic. Novel drugs, novel targets are being discovered. And we're beginning to also understand how we might combine immune therapies with targeted therapies. Targeted therapies can spare the immune system and even enhance immune responses, and therefore can potentially be combined with immune therapies to be much more effective. This year we're going to put a greater emphasis on clinical trials, in particular clinical trials that are very much science-driven, biomarker-driven trials, trials where we're understanding the science behind why patients are responding. A lot of excitement in the meeting takes place in the hallway, where you bump into a colleague and say, "Oh, what are you doing?" "Oh, we just had this exciting result. You know, come to my poster or come to my oral presentation. You'll really like this result." So that kind of personal interaction is really critical. I think coming to the annual AACR meeting is the most critical thing in the career of a young scientist. This is an opportunity when the young people present posters or oral presentations for the leaders of the area to hear what they're doing. The editors of the AACR journals may come up to them and say, "Please, this looks really exciting, please submit it to my journal." So there's the opportunity to enhance the ability to publish, and of course to get a job. You're going to meet the people who are going to be searching for young assistant professors to hire. This is an opportunity for them to get to know you, and of course the people who are going to be reviewing your grants are probably going to be in the room as well. So the AACR is really a unique organization in the area of cancer. First of all, it doesn't focus just on one type of cancer. And secondly, it brings together the basic scientists with the clinical scientists in a way that I think no other organization tends to do. Most are either focused on one area or the other. I see the AACR as the organization that's been most successful in bringing those two groups together. The AACR is the site where the translation occurs. By translation in two ways. Translation in that we're translating basic science into clinical treatments, but also translation in that we're translating the words of the basic scientists so the clinicians can understand them, and vice versa. The basic scientists often don't understand the language of the clinician. So we are a translator in two different ways. We bring everybody together, 20,000 people or so, with wide varieties of backgrounds together to all listen to each other and hear what's happened in the last year. This is the chance to catch up on all the advances that have happened in the last year. The clinical trials that we present here are always backed up by a very detailed description of the science behind the trial and the evidence that whether the science is played out in the responses that one sees in the trial. This is something that's not often done in other settings.